So, good afternoon, ma'am. My name is REONAL, and I will be performing for the suctioning procedure. Then, suctioning is the aspiration of secretions um, through a catheter connected to suctioning machine or wall suction outlet. Then, the purpose of this is to remove secretions, to facilitate ventilation, to obtain secretions for diagnostic procedure, and um, to prevent infection. So the equipments needed po are the um, suction catheter. For the adult po is French 12 to 16. Then for the children, French 8 to 10. For infants, French 6 to 8. And then suction machine, NSS or the sterile water, sterile gloves, connecting tubing, towel, um, the sterile basin, stethoscope, and light, and then pulse oximeter. So, first, verify doctor's order. So, assess for the size of catheter, the type of solution, the airways to be suctioned, the nose, mouth, and trachea, and then for the pressure to be used, then go to patient's room, explain to the client what you are going to do, why it is necessary, and how he or she can cooperate to the procedure. So, inform the client that suctioning will relieve breathing difficulty, and the procedure may be painless but um, may be uncomfortable and stimulate cough, gag, and sneeze reflex. Then, assess the need for suctioning, so the gargling respirations, restlessness, the vomitus in mouth, and then drooling. Then after that, assess patency of nears, then wash hands and observe other appropriate infection control, then um, provide comforts, privacy, and safety to client, then put a towel to the client's abdomen. Then after that, monitor oxygen saturation via oximeter and heart rate during insertion. Then after that, open the sterile equipment, um, and then attach it where closest to client, and then after that, indicate the date and time. Open sterile basin, and then put NSS or sterile water, about 18 centimeter, 18 inches above basin, and then um, after that, um, so test for the um, test for the suction, test for the suction machine, and then so assuming po ito yung suction machine. Then after that, make sure that the depth of the insertion of catheter is um, well good, and um, test the equipment. Then after that, so test the pressure on the suction, and then the patency of catheter, and then ask client to inhale deeply, and then lubricate the catheter with the anesthetic jelly, and then um, for the oropharyngeal suction, so place the client into semi-Fowler's position, then pull the tongue forward. If necessary, use gauze pad, and then do not apply suction if the uh, if your finger off the port. So um, advance the catheter about 10 to 15 centimeter, 4 to 6 inches along one side of the mouth into the oropharynx. So um, I am now going to put my sterile gloves. So um, with the with my sterile glove hand, so pick up the catheter and attach it to the suction unit. So assuming po na ito po yung catheter, and then attach it to the suction. Then for the nasopharyngeal suction, so we should also place the patient in a semi-forward position. Then um, um, measure the distance between the um, client's nose and the earlobes, about 13 centimeter for an adult. And then um, for the um, so without applying suction, insert the catheter at the pre-measured at the recommended distance. And then for the suctioning, so apply a solution to the catheter, and then check patency of the suction catheter, the suction pressure, and then moisten catheter for ease of insertion. Then apply your finger to the suction control, and then start suction, and then gently rotate catheter. And then for the apply suction for 5 to 10 seconds while slowly withdrawing the catheter. Then remove the finger from the control and remove the catheter. And during this time, so catheter is inserted, and then the suction applied will discontinue, and then encourage the client to breathe deeply and to coughs between sections, and then obtain a specimen. If required, use a sputum trap. Then when suctioning is complete, suction um, between cheeks and under tongue. So suction mouth last to prevent contaminating catheter, then promote client comfort. Um, Wipe off the catheter with sterile gauze. So assuming ko na sterile gauze. Then after that, relubricate the catheter. Then allow 20 to 30 minutes, seconds, or allow 20 to 30 minutes, allow 20 to 30 seconds intervals, and then alternate nares for um, the catheter, and then dispose of equipment. Then after that, assess the effectiveness of suctioning. So auscultate the clients um, if if the secretions are clear um, to the um, airways of the client. So after that, so reassess client. Um, if the secretions on mouth or nose, then um, how do you feel after the suctioning? And then after that, um, discard gloves, wash hands, and then um, record the procedure, record or document the procedure. So um, indicate um, the date and time section, and then the um, the the outcome of the um, or the aftercare of the suctioning, and then that's all po, and thank you. Okay.